So, as an experienced foot and ankle specialist, are there any top tips you could give to therapists treating foot and ankle conditions? Yeah, look, this is a great question, and I think we all know the answers to this. It starts with a really good history. Listening to the patient is crucial. Often you can make up your mind and get the correct diagnosis within the first 5 words. Okay, so as they come into how did this happen, and then again on examination, it's the magic finger. They will point to where the problem is. You know the anatomy, so you've cheated because you've done your due diligence. You know the anatomy, and then it's really how badly is that anatomy damaged? What are the links to that anatomy? Can I help that anatomy? Can I rest the anatomy? Resting the foot and ankle, really, really difficult. So think around it. So number 1, history. Number 2, examination. Number 3, know when to call for help. Okay, we all do it. I call for second opinions all the time. It's really important. We're not silos. We can't exist as silos. We've got to work as teams. We've got to work as groups. And we're a bit self-selective. You know, you've got friends in the industry that you trust. I've got friends in the industry we trust. Together we form a bigger network and a collaborative. I think that's really, really important. Information. So the more information we can get, that could be old imaging, could be new imaging, it could be different imaging modalities, so an ultrasound versus an MRI scan versus a CT scan. First being quick and dynamic, isolating where the pathology is. Number 2 being actually really, really helpful, transparent, visualization, seeing exactly where things are. These aren't necessarily expensive nowadays as well. The key to an MRI scan is partly the machine, but also who's reporting it. It's really, really important. Build a relationship with your musculoskeletal radiologist. Okay, have each other's numbers. Look, I'm not sure about this problem. I think it's this. Can you have a look? Oh yeah, this is the problem. So you're cheating. You've got the patient. They're cheating. They've got the images. Okay, so you come together on the phone. You know, I've got a few guys I call all the time. They are absolutely amazing, and it really helps my practice, help my patients. Okay, and the last one, CT scans. So if you need plain X-rays, great for bones. 3D bones, CT scans. So I've started doing a bit of virtual reality work, which is great. The CT scanner can help that image formulate in my mind while I'm operating, which is fantastic. It pulls the whole thing together. So that there are my top tips. They're basic tips, but kind of common sense prevails with this. You know this. I'm not here to preach anything that you don't know already, but it's to reinforce and hopefully give you confidence and energy to say, you know what you're doing is right, okay? And it's just the timing of everything.